Hello, everybody. This is Gary. Today is January 25th, 2023. It's Wednesday. It's 1:11 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today my mental health symptoms are not that bad. My anxiety levels are not that high. My delusions and paranoia are not that intense. My auditory hallucinations are at a bare minimum. My depression and anxiety are not that bad. I did go out for a walk today and did my physical therapy exercises. I did some work on my computer. I do consumer surveys for extra money. Um, I meditated twice. I went to the pharmacy and picked up some of my prescriptions. Um, so my emotional and mental health symptoms are not that bad today. Um, I have an appointment tomorrow with my peer support specialist, and we'll just be talking about things that have happened over the past couple of weeks. A peer support specialist is somebody who has a mental health diagnosis who works on staff as a counselor at the clinic I go to. She's very good to talk to, and I have a psychotherapy appointment with my psychotherapist next week. And I believe on February 3rd, I'm seeing my psychiatrist next week, which I believe is Friday, and we'll be talking about a few things. I saw my primary care doctor yesterday, and she said that I definitely do have pulmonary fibrosis, which means I have scar tissue forming in my lungs that makes it more difficult for me to breathe. Of course, it helps if I try and lose weight. I'm 30 pounds overweight, and that puts extra pressure on my lungs and my ability to breathe, so I get winded and out of breath very quickly. But it's also due to the pulmonary fibrosis. Um, we're not exactly sure what caused the scar tissue to develop in my lungs. There's a lot of different causes for it. People might work on a job where they get exposed to dust of some kind, or asbestos, or something like that, or some sort of chemical. I'm not sure what I've been exposed to. My medical doctor asked me yesterday if I was exposed to any chemicals over the past few months. I go, the only thing I could think of is that I'm using too much bleach to clean my apartment over the past couple of years. And maybe I used too many pesticides to kill roaches in my apartment over the past few years. Beyond that, I couldn't think of anything that I was exposed to that would cause scar tissue in my lungs. But anyways, I do get winded very easily. I do get out of breath. I still try to exercise every day. Um, I have an appointment in late March with the pulmonologist, which is a pulmonary expert. They will do a breathing test to see how strong my lungs are. Um, we already did a CAT scan of my abdomen, which is what picked up the pulmonary fibrosis in my lungs in the first place. So I will be seeing a specialist in late March, and I'll find out more then. Until then, there's not much I can do, except keep doing the things that I've been doing, keeping up with my daily responsibilities, taking my medications, seeing my therapist, keep my medical appointments, keeping my psychotherapy and counseling appointments and my psychiatry appointments. Um, I haven't had a cigarette in 12 months. It's weird because I had a lung scan to screen for lung cancer last year, and it didn't show any pulmonary fibrosis, and it certainly didn't show any cancer. It showed some small nodules in the bottom of my lungs, but there was no scar tissue. That seems to have developed over the past 6 months or so. Um, so I will be seeing a specialist in late March, and right now I'm not on any medications to treat it or to slow it down. Um, I don't know if even if there are medications that can slow it down. Um, I'm just trying to get as much information about pulmonary fibrosis as I can. It does make my anxiety a little higher. It's not fun to have anything wrong with your lungs, whether that's from smoking or from work or from something else. Um, I know of some people who have pulmonary fibrosis that take supplemental oxygen with them. I have not reached that stage yet. We're not even sure how advanced it is, how advanced the scar tissue is, or even if it does advance, how fast it will advance. Um, that's what I'm seeing the specialist for. Um, but it's definitely not caused by any of my psychiatric or other medical medications. Um, I saw one case on YouTube where somebody was going through chemotherapy for cancer, and those chemicals can cause pulmonary fibrosis, but I don't have cancer and I've never had chemotherapy. So that can be the cause of it. We're not sure what's going on yet, but I will keep everybody up to date. Um, Otherwise, I'm feeling pretty good today, a little bit more normal. And like, comment, share, and subscribe.